Hello, everybody. Since we only have a half an hour, this is going to be pretty quick, and I'm going to touch on the highlights of the 2018 CPT code updates. As a reminder, CPT is a registered trademark of the American Medical Association. All rights are reserved. I am allowed to use it for educational purposes. So we're going to cover what's new in 2018, some E&Ms, questions, we're going to cover some modifiers and some different system updates. There was 170 new codes this year, 60 revised codes, 82 deleted codes. That's a total of 312 changes in the 2018 code book. So we have a total this year of 10,155 CPT codes. In the E&M section, we had 4 codes added, 4 revised. Anesthesia had 5 added, 5 deleted. Surgery had 42 with 24 revised, 19 deleted. Radiology had 7, 3, and 18. Path had 40. I'm not really going to go into that a lot. They had 17 revisions and 12 deleted. In the medicine section, there was 14 added, 10 revised, and 4 deleted. Category 2 codes and Category 3 codes. PLA, proprietary labs. These are laboratory tests that are proprietary and reserved. So the codes have been added. We have a total of 170 added, 60 revised, and 82 deleted that we're going to try and review today. Modifiers. We have 2 new modifiers this year, 96 and 97. When a service or procedure is it can be either habilitative or rehabilitative, and the Affordable Care Act mandates that the habilitated and the rehabilitated services are covered equally with each other. Habilitative services are services that help an individual learn, keep, improve skills and functions for daily living. Rehabilitated services are services that help individuals keep, get back, or improve skills and functions for daily living that have been lost or impaired due to a sickness or hurt or a disability. Evaluation and management. If everybody recalls, there was a lot of talk during the final rule that they were going to change the 97 and the 95 guidelines this year. CMS made the decision that they're not going to change the guidelines for the 97 and 95 E&Ms. What they are doing is considering them for a later date, and it will be readdressed. From the talk that I heard, a lot of people are pushing that the qualifier would be medical decision making. Basically, that issue has come up because of EHRs. If a physician is using an EHR and they're automatically pulling forward all their history elements, their exam elements, and a lot of these elements aren't medically necessary for what they're doing, they can, if it's an established patient, they can get a 5 just on those documentations. So look for changes in the years to come on the 97 and 95 guidelines. Tell your providers to be careful, make sure that everything they pull over and document is medically necessary, because that's the criteria for CMS. If they review something and determine it wasn't medically necessary, they may drop your codes. Evaluation and management. We have new codes in the E&M section for cognitive assessments and care plan services. These were formerly G codes, G0505, and basically when they perform a comprehensive evaluation of a new or established patient for cognitive impairment. All elements of these codes must be present to bill, and a single provider should not report this code more than once every 180 days. The first code would be all of the elements and at an estimated 50 minutes elapsed. If it takes longer than that, they can bill the 99354 for each additional 30 minutes. General behavior, this is basically the same thing, but it's on a case management service for behavioral health conditions, and it's at least 20 minutes. It was formerly G0507 99484. 99497 is advanced care planning, and code 99483 cannot be reported with 99497. 99492 is an initial psychiatric collaborative care management. It's formally G0502. Care management codes can only be billed by one provider. So if you note it, and that would be the treating physician. So you have the first 70 minutes in the first calendar month of behavioral health care management activities in consultation with a psychiatric consultant and directed by the treating physician or other qualified healthcare. So you're going to have a team of providers working together. There would have to be an agreement between the treating physician and any other providers that they have included in this. And a care management plan has to be made. If you do a subsequent collaborative care management plan, which was formerly G0503, that would be 99493. And that's for the first 60 minutes. 99494 is an initial or subsequent psychiatric collaborative care plan, each additional 30 minutes. And that was formerly G0504. So we have hospital observation. They did not change the code. The code is still there. The only thing they did was add the words outpatient hospital so you know what the place of service is. For your NICU, PICU, neonatal intensive care, they revised the coding to tell you that different specialties of the same group or someone of a different group can also bill that at the same time. So you can have that code multiple times by multiple providers as long as they are different specialties or different groups. Anesthesia had 5 new codes: upper GI endoscopy procedures, a retrograde cholangiogram procedure, lower intestines, and screening colonoscopy, and then combined upper and lower GI codes. They deleted 2 codes, 00742 and 00810. And if you see, I referenced the new codes that were added. What they did was they took 00742 and split it into 2 codes, and they took 0810 and split it into 3 codes so that they could specify what area of the different GI tract was being looked at. Integumentary system. We have a mid-face flap with preservation of vascular pedicles. This is basically a lot of your cosmetic plastic surgeons will use these codes, and they're both different ways to do the muscle flaps. 19294 is preparation of a tumor cavity with placement of a radiation therapy application for intraoperative radiation therapy concurrent with a partial mastectomy. And you list separately in addition to the code for the mastectomy. So you would do the mastectomy, and then you would do, if they're making a cavity for the radiation therapy, you would add this 19294. They deleted 2 codes from the integumentary. They deleted the muscle flap, and they replaced it with the other 2 that we saw, and they deleted chemical cauterization of granulation tissues, 17250. Musculoskeletal had 1 code added, and it's a bone marrow aspiration for bone grafting, spinal surgery only through separate skin or fascial incision, and you list it separately to the primary procedures. And there's parenthetical notes which give you instructions on which primary procedures this code should be used with. Respiratory has 5 new codes added. We have nasal sinus surgeries with ligations, nasal sinus endoscopies with ethmoidectomy, total, your anterior and posterior, including frontal sinus, and then we have the total AP, the sinus endoscopy total AP with sphinctotomy, and the total A&P, including sphinctotomy with removal of tissue from the sphenoid sinus. We also have a nasal sinus endoscopy surgical with dilation of frontal and sphenoid sinus ostia. It's a balloon dilation. And then we have ablation therapy for reduction or eradication of one or more pulmonary tumors. Cardiovascular had quite a few additions. They had 12 additions. It's quite a lot to be able to go over in a half an hour. So if you're into cardiovascular surgery, you want to make sure that you check your CPT book, review all the new codes. There's a whole new section of instructions and parentheticals, so you want to make sure you please read them carefully and review them with your provider so that they're using the appropriate codes. We have a lot of new and emergent technology coming through, implantation of a total replacement heart system. So there's actually a code for an artificial heart. So removal and replacement of a total heart system, removal of a total replacement heart system, artificial heart for heart transplantation. You're going to list separately for the additional codes. Your endovascular surgeries, there's several different methods to do your endovascular, and it basically depends on where you start the procedure from, so you want to review all those codes. Digestive systems, esophagectomy. Basically, what they're doing is they have 3 new codes, and there's different areas that you would be operating in the esophagus. So each code is for the separate area. If you're into GI surgery, general surgery, you want to make sure that you review those 3 codes, and make sure that your physician is aware of those three codes. I really can't stress enough that you want to make sure, if your physician is in this specialty, that they're aware of the new codes in their specialty, no matter what it is, whether you're general surgery, GI surgery, your genitourinary, female surgery. You want to make sure your physicians are aware of the new codes, surgical code options that they have. Genitourinary, we have transperineal placement of biodegradable material, periprosthetic, single or multiple. That's basically on a male, because we're doing the prostate. And then we have a new female surgery, laparoscopic surgical total hysterectomy for resection of malignant tumor debulking with omenectomy, including salpingo oropectomy when performed. You want to make sure your surgeons know about this, because I know a lot of surgeons do the debulking and they didn't have a code to use previously. Make sure that they're aware of it. Neurology. 2 new codes for nerve repair with allografts. So if they're doing a nerve repair, depending on which nerve repair they're doing, they're going to have different codes for it. If your doctors do this, again, I can't stress enough, you want to make sure you review these new codes with your providers. Radiology. Now, we have 7 new codes in radiology. Basically, what they did was they took the chest x-ray and they changed it from AP, lateral, PA, and they just said different views. So you have a single view. That was normally your AP. You have if they're going to take 2 different views, 3 different views, and 4 different views. Now, when they say a different view, they're not taking the same view twice. So they're not going to do an AP twice. They're going to do an AP and a lateral and a PA. That would be 2 views. So you want to make sure you have documentation of each view that was done and each view that was reviewed by the physician. So when your radiologist is going to report 3 views, you have to make sure that they document something on each view, whether they're saying normal, not normal, but you want to make sure that they document something on it. Same thing with the abdomen. We have 74018, 74019, and 74021. It's basically 1 view, 2 views, or 3 or more views. So if they do 3 or more views, it's 74021. And the same thing goes for this. When your radiologists are reporting it, you want to make sure that they report it appropriately and they document each view, that they looked at each view. So to support their codes. Medicine. The medicine section has several different codes added. We have 13 codes added. Exercise test for bronchospasm, pulmonary stress testing. It's a 6-minute walking test. Photodynamic therapy for external light to destroy premalignant lesions. Now, I went to the AMA symposium back in November, and the dermatologist who talked about this, it's actually zapping malignant lesions with the photodynamic therapy. So it sounds rather interesting, like an interesting procedure. I'm not sure, you know, your physicians are going to look at this and say it's great, but you have to take into consideration how much the equipment's going to cost and what your reimbursement's going to cost. So I'm not sure that every dermatologist out there is going to go and get this therapy right away. Debridement of premalignant hyperkeratotic lesions. Now, 97127, therapeutic intervention that focuses on cognitive functions. This is a new code in CPT, but note, it's invalid for CMS. If you have a patient who has Medicare Part B, you're going to use G0515. You're going to continue to use that code. That was a decision by CMS, and I don't know why, but they've decided that they don't want to use this new code yet. 90587, dengue vaccine. It has not been FDA approved yet. I don't know how many cases we're going to see of it. It's probably something that you would get if you're going abroad. We have two influenza vaccines, 90756 and 90682. A new zoster vaccine, basically the dosage is changed on it. And then we have the ambulatory continuous glucose monitor via subcutaneous sensor. And this is basically when the patient provides already has the sensor in them, and the doctor is getting the information electronically, and they're reviewing it to see what the patient's sugar levels were during any specific time. So I guess I went through that pretty quick. Does anybody have any questions? Remote questions. I went through that pretty here. Okay, so it doesn't appear as if we have any questions. We have If anybody has any questions, you have my email address, you have our phone number, and as Gabby said, she will have the recording available later on this afternoon or tomorrow on our website. So I want to thank everybody for joining us today. I know it was rather brief, but if we hit on everything and we did a lot of details on everything, it would have taken more time. So have a great afternoon and thank you for joining us.